My name is Pamela Luke, and I am an orthopedic foot and ankle surgeon at Congress Orthopedics in Arcadia. What sets me apart from other orthopedic surgeons in the foot and ankle field, beyond what is the obvious, my gender, and being female in a very male-dominated field, is that I have the benefits of being relatively new to being on top of the new innovations, but I do come from a very conservative background. So I am willing to offer my patients the full range of conservative and new technology in terms of their treatment for their foot and ankle.
This is Sabrina. She sprained her ankle, so we have to get her some crutches, and I wanted to show her the lace-up ankle brace we have. Okay, come on.
I think that being a female in this field is a huge benefit. I remember an article that my mom sent me about patients having a lower mortality rate when their primary care physician and other doctors are female. Our perspective is a little bit different. We're looking at maybe a larger picture, and so I think I do try to pay attention not to just the foot and ankle condition, but their socioeconomic condition, their financial status, their home situation. It does play a role to know how you're going to heal after surgery if you are having to cook or provide for your family. The considerations of other medical problems are also very heavy on my mind when I discuss surgical options with patients. I was very fortunate this year to be selected as one of the top 40 doctors by the LA Business Journal, so I'm very grateful for this honor. As a patient, I know that there are a lot of choices in terms of care providers. Although I'm a surgeon, not everything requires surgery to treat. I want to do whatever's in your best interest with whatever you're comfortable with to get you better and to get you to the level of function and activity that you want. In my sophomore year of high school, my father had a heart attack and required quintuple bypass surgery. I was very grateful for the cardiovascular surgeon who restored my dad's life, allowed him to stay with us. It was definitely my goal to help others, similar to what the cardiothoracic surgeon did for my father, and give back to others what was given back to me. I do volunteer for our National Foot and Ankle Society. I'm currently the chair of our Young Physicians Committee, and our goal is to provide new initiatives on the training and further education of orthopedic surgeons around the country. Before I went into med school, my goal was to be a professional ballerina. Things kind of turned out differently. I started dancing at the age of 4. It's a great type of exercise, but it provides great stress relief for me. It allows me to just stop thinking about anything else in the world for about an hour and a half. And I think it's a great blend of artistry as well as musicality. I think that my training in ballet helped me a lot for my medical career. It gave me the perspective of a physical activity that relies heavily on the body, and so I try to keep that in mind as I speak to patients and hear about what their return to function goals are. At the end of the day, I truly believe that a satisfied patient is what matters the most.